This is Arab Talk on KPOO 89.5 FM in San Francisco. This is Arab Talk with Jess and Jamal. I'm Jess Hannan.
And I'm Jamal Dejani.
Jamal, despite international condemnation at the government and military of Israel and Prime Minister Netanyahu, he has decided with his security cabinet to invade and occupy all of Gaza, including Gaza City, which would put the entire 2.2 million Palestinians under grave danger, even more than they're under now. The genocidal starvation policy of the Israeli government continues unabated. The continued starvation of Palestinian children has reached epic proportions globally. We're seeing international condemnation, especially coming from France, UK, as well as Germany, who have announced together that they will probably, kind of indicate that they are willing to support and acknowledge a Palestinian state. This is an incredible historical moment, Jamal. Palestinian civilians and children especially are starving to death, and only now, after close to 2 years, people are taking notice. It's a real tragedy. We're going to be talking about the political implications of that today, Jamal. But before we do that, we're going to review the fact that 2 Israeli human rights groups have released reports determining Israel is committing genocide. One is B'Tselem, the other one is Physicians for Human Rights in Israel, which issued a report focused on the destruction of the Palestinian healthcare and life-sustaining systems in Gaza and is entitled Destruction of Conditions of Life, a health analysis of the Gaza Genocide. You did a fantastic interview with Aseel Aburass. She's the director of Occupied Territories, Department of Physicians for Human Rights in Israel. And the two of you discussed this very important study.
You're absolutely right, and this breaks the taboo. Many human rights organizations, international human rights organizations, political figures, etc., have called it a genocide. But now you have the 2 leading Israeli organizations who basically underline that statement. Let's watch Aseel Aburass. There is a global consensus that Israel is committing genocide and mass starvation against Palestinians in Gaza. The number of international human rights organizations, genocide scholars, public officials, and UN representatives asserting this is growing. Most recently, Omar Bartov, a leading authority on Holocaust and genocide studies, published an article in the New York Times providing evidence of Israel's genocide in Gaza. Now, 2 well-respected Israeli human rights groups have released reports determining Israel is committing genocide. One is B'Tselem, an Israeli Center for Human Rights in the Occupied Territories. The other, Physicians for Human Rights Israel, issued a report focused on the destruction of the Palestinian healthcare and life-sustaining systems in Gaza and is entitled Destruction of Conditions of Life, a health analysis of the Gaza Genocide. Joining us on Arab Talk is Aseel Aburass, Director of the Occupied Territories Department at Physicians for Human Rights Israel, to discuss the findings that led to the report's genocide determination. Welcome to Arab Talk, Aseel.
Hello.
So, why did Physicians for Human Rights Israel decide to release its report now? Was there a tipping point or determining factor that allowed it to view what Israel is perpetrating in Gaza as genocide?
If there was a tipping point, I think the tipping point passed long time ago. Why now? We are now releasing after 22 months where we were documenting the atrocities, the war crimes that has been happening in Gaza by Israel. For 22 months, we've focused on the destruction of the healthcare system, and I am sure that your listeners know what has been happening specifically on the healthcare system in Gaza. The destruction not just of hospitals but also conditions of life, and the accumulated evidence that we've gathered, and many before us. You started by mentioning that this is not a first. Human rights organizations, scholars, genocide scholars, amongst them also Israeli scholars, of course Palestinians, have been saying that this is a genocide. from almost from the beginning, because this started as a genocidal campaign. From the very first few days, we heard, cabinet Israeli members, decision makers, Israel's own president and prime minister saying that civilians, there's no civilians in Gaza, all of them should die, we're stopping electricity, we're stopping water. This started as such. This started as a genocidal campaign. And throughout, we've witnessed not just mass killing, and of course, mass killing happened. We reached 60,000 Palestinians who have been killed by Israel in Gaza, and this is just an understatement. We know that this is the numbers, according to every research about the numbers. This is just this is an understatement, and this is a modest number. We know that when investigations, independent investigations, can go in and can pull out, the thousands and thousands of people who have been under the rubble, the number will go much more than 60,000. But we've analyzed not just the mass killing, and we know that that happened. We also analyzed in the Genocide Convention, Article 2C, which relate to the conditions of life, destruction of the conditions of life, because the way we analyze it is when you destroy, the very core of how people, healthy and what makes life a living, clean water, access to nutritious food, and not just food, nutritious food, freedom of movement, house, education, universities, hospital, the whole healthcare system. When you destroy all of these, you create a living condition where even when there's a ceasefire, even if there's a ceasefire today, people will continue dying, maybe not from bombs, but from illnesses that couldn't be treated because the healthcare system has basically been decimated by starvation. And we're hearing about it now every day. There's another child that is dying from starvation. People will continue, and unfortunately, specifically for children and for people with chronic diseases, the starvation could be irreversible, right? So people will continue dying even when the last bomb have been dropped. So this is why we looked at it as a genocide, looking at the conditions of life, and more specifically, the healthcare system that has been destroyed for the past 22 months.
You've mentioned Article 2C of the Genocide Convention. Just to be clear, there are 5 acts that are described in the Genocide Convention, any one of which constitutes genocide of intent to destroy the targeted group is proven. Your report focuses on Article 2C, deliberately inflicting on the group conditions of life calculated to bring about its physical destruction in whole or in part. Within this context, what are the most egregious, irrefutable acts committed by Israel that implicated in this genocide?
Right. So, as you mentioned, there are we focused on this article because it's enough to prove one, and then we can call it a genocide. Many researchers and many organizations have proved the other articles, but we decided to focus specifically on that. In our report, we even show the first article, which is killing and then bodily and mental harm. We also proved that, but our main focus was on conditions of life. Now, specifically, what is the conditions that we looked at? We first looked at we looked at basically, first of all, the healthcare system that has been destroyed, mentioning, long-term care. Obviously, now we know that Israel have inflicted and destroyed 33 hospitals from the 36 hospitals that are in the Gaza Strip. The healthcare system is damaged beyond, you cannot even with the ceasefire, you cannot just come and rebuild hospitals that have been giving, care for 2 million people for the whole of Gaza. You cannot just easily, it's not something that you can easily rebuild. And in the meanwhile, people will continue die from illnesses and from untreated illnesses and wounds. This is one thing. And then we looked at other conditions. So we looked at, for example, food. We looked at how Israel have used starvation and aid as well as a weapon in how it's conducting this war. from the beginning, first few weeks into the war, Israel have stopped water, stopped electricity. Electricity is not just for light, right? Electricity is for all services and all, it's for cleaning water, purification, and for hospitals. We hear from our colleagues in Gaza that sometimes hospitals need to close the AC just to save the what is left from the electricity, from the fuel, right? And we know that AC is also not a luxury. AC in a hospital is super super important to mitigate, bacteria, infectious diseases. So this is one. From the first few weeks, Israel have stopped those conditions, the food, the water, the electricity. And then throughout 2024, we've seen sometimes the Israel is allowing more to go in, sometimes not. And this is exactly the point. Israel have been deciding exactly what goes in, who gives it, and who receives it throughout this whole 22 months. More specifically, since March 2025, Israel have for over 70 days have basically um, 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 closed all borders, didn't let any food, any water, any nutritious food into the strip for more than 70 days. And now we're seeing the consequences, unfortunately. And we've heard on the news, airdrops coming, more airdrops are coming in, and Israel is letting, because of international pressure, it's letting food in. But this is not enough. This is a drop in the ocean, specifically because all of the mechanisms, the UN mechanisms that were in place before March 2025, have been destroyed. And Israel, instead of that, and the US have introduced the so-called GHF. H stands for humanitarian. They are far from humanitarian. And while looking for food and waiting for food, um, 1,200 Palestinians have been killed in those, distribution camps, or I call them concentration camps, waiting for food. So this is another thing. Water. Israel have also, from the very first few months, Israel also destroyed water wells, um, and basically cut off the water that comes into Gaza. We've also looked at determinants of health that are social and environmental. We look at health is not just if you have, if you're sick or not sick, but to be healthy is much broader than that. To have access to education, to have access to shelter, this is part of being healthy, right? This is all of these for us sitting in AC houses. This is a no-brainer. This is something that we're used to. But for the past 22 months, Israel have displaced 90% of the Gazans, destroyed 92% of houses. So there's no shelters right now. People are sheltering in a makeshift tents, if you can find, of course, tents. Many don't have tents, overcrowdedness. This is also part of the social determinants of health. There's no education. Why for the past 22 months there's no education system. you know we looked also on the environmental conditions of health. So the environment is toxic itself, and many reports, we didn't analyze it, we didn't go in deep, but there's many have been calling it also an ecocide, right?
Mm.
Croplands, farms. So it's not just that you're stopping food from coming in, you're also destroying farmland and crops, and Gazans now cannot even grow their own food. I need to remind that for the past 17 years, Gaza was under siege. And they were able, even with this tight grip, even with this blockade, they were able to produce their own food. And this is also something that has been taken, and it's it's not a decision only for the now. And as I also already mentioned it before, it's not just for the now, it's also for the future. It's years and years and years to come where the Gaza society have lost the very main conditions that make life possible. And this is related to, as you mentioned, the 2C article, inflicting um, um, conditions of life that makes life impossible to live.
With everything you've mentioned, including Israel's complete destruction of most hospitals in Gaza, as well as its torture and killing of doctors and medical professionals, is this unparalleled in a war in modern times?
Yes, it is unparalleled by any conflict. 1,580 health workers have been killed and 300 have been detained. This is numbers that we didn't hear before. Um, so the killing it didn't start by the killing. It started with the delegitimization of the healthcare system. This allowed the killing and this allowed the targeting from, I want to say, even before 2023, before October 2023, Israel have been waging a war against hospital and against the healthcare system by delegitimizing it. We all heard about the command centers in Al-Shifa, that there was no base for it, there was no evidence for that. And this created the green light for Israel to continue with its destruction on the healthcare system. This is one. But then after this green light have been given to Israel by Western countries, by European and by North America, Israel have continued with this destruction. So far, we're talking about 1,500, more than 1,500 healthcare providers that have been killed. Many are senior in their profession. 300, more than 300 have been detained. Up until now, we know that at least 100 are still being held in custody. They have endured torture. Torture. We also know about sexual violence in the prisons, and very inhumane treatment. And this is, again, this is affecting the Gazan society as a whole, also on the long term, because, and I'm not saying it lightly, but a hospital you might be able to build, and again, I'm not saying it lightly, because these hospitals are historical and not just practical, but they hold also a history. You could, bring in cement and build, rebuild some parts of the hospital, but a doctor that has been, studying and putting, you know, 30 years of their lives to get to, to where they are as senior, cardiologists and surgeons. You cannot bring that back. This is resources that the healthcare system have lost that you cannot bring back. The last cardiologist have been Marwan al-Sultan that we heard. It was in the beginning, just 3 weeks, 4 weeks from the beginning of July, have been killed by Israel in his own house with all of his family have been killed. This is a cardiologist that have studied in Jordan and have studied in Gaza. He's also a lecturer in the Islamic University in Gaza. You cannot bring back. You need years and years and years. You have lost and right now, all of the north in Gaza have have only one cardiologist left after he have been killed. So this is affecting the whole healthcare system. They are the core. They are the core, not just of the healthcare system, but of the Gazan society. And he have been killed just like that with all of his family. And since then, there were more healthcare workers that have been killed, and nobody is stopping Israel, unfortunately.
Let's talk about the report itself,
Yeah.
the process, the methodology, and how it was done. For example, do you have researchers on the ground in Gaza? Did you have ongoing communication with healthcare workers, with people or other people in the medical field? Did you collaborate with other organizations?
Mhm. Yes. So thank you for this question. So before October 2023, PHRI had a mobile clinic, a medical delegation that used to go to Gaza at least 12 times a year. And it's Palestinian doctors with Israeli citizenship that were able to go in. And we provided not just medical care, but also we have collaborated with Gaza's own medical healthcare providers. We have passed courses, and we have exchanged knowledge since October. And of course, we also, this is how we gathered as well information, and this is how we got our own. We documented what is happening in Gaza since October. Basically, the Israeli army have not allowed us. Actually, we were supposed to go in. We had a medical delegation that was supposed to happen on the 12th of October, 2023. Of course, it was not allowed to happen by Israeli army, even with our petitions and even with us trying, we were not allowed. So unfortunately, and this is not just for PHRI, but also, for journalists, for human rights organizations, most of them cannot go in, and we have to conduct our research from remotely, even though from Jerusalem, Gaza 70 kilometers, right? And we were supposed to conduct our research and our report remotely. Because we've been going to Gaza for more since 2006, basically. We have very good connection with our colleagues in Gaza that have that continued providing us with information. This is the main source, amongst, of course, Ministry of Health numbers and documentations, WHO, OCHA. These are UN agencies that have been working in the Strip since, for the past 22 months, and of course Palestinian organizations that still have a field researchers in the Strip. And this is basically how we were able to conduct this research, by having all of this information, and then comparing everything together. And this is how we were able to conduct this research. We have also spoke to people. We spoke to women, pregnant women, and women who have um, experienced pregnancy and motherhood within the war, and this is part of the research. And we have also another report that is coming up that will include that. So, to your question, most of the information that we have is being gathered remotely. This is the methodology, and then we are able to look at all of this. And it is not, even with the fact that people are not being allowed to go in, there's a lot of research coming in. There's a lot of reports. There's a lot of assessments. The last one was by the IPC, that is responsible on assessing hunger and famine in Gaza. And what is astonishing to me is that with all of these amount of research and numbers and documentation, and I call it warnings, Israeli government, Israeli army did not, they saw what is happening and they didn't stop. They saw what is happening and they continued. And the last, we all heard the last propaganda, the last Zionist propaganda has been calling the hunger as a hunger campaign, the Hamas hunger campaign. With all of the reports, with all of the numbers, with our own research, right? That is ours and B'Tselem's, that is also in Hebrew. We're also part of our advocacy is also trying to speak to the Israeli community, to Israeli society. It's still not being heard by 99.9% of the society, and also by the government, unfortunately.
Well, as you know, Israel has vehemently denied the charge of genocide, which is expected because they've been denying it all along. Have you experienced a backlash by the Israeli government or even the public, since you are only one of two Israeli organizations to charge it with genocide?
Right. Unfortunately, on Monday we published the report in our press conference, and there was a lot. Actually, we didn't expect that much. There was a lot of coverage by international media, but none by at least mainstream. There was, of course, mentioning in a left news outlet like Haaretz, for example, but mainstream and center to right, there was nothing. There was no coverage of this report. The first one was 24 hours after. So I can assume that 99% of the Israeli public did not see the report. They don't know about what we have written. But for the reactions that we did get, mostly by our community, it was saying, finally, finally one of the human rights organizations are saying it. What we hope is that it will create a snowball, that more organizations will join this and will also call it for what it is, a genocide. Um, but to your question, no. In terms of backlash, up until now, there's no backlash. Of course, we were ready for scenarios. We've done risk assessment, and we were ready for scenarios of backlash. So far, there was no backlash either by the government or by right wing by right wing people. Um, but we hope it will get to more. This is part of our advocacy. It's not just to prevent, but also to for the Israeli society, for the Israeli society to know what is being done in their name in Gaza.
The timing of the release, was it coordinated with B'Tselem? And if so, did your organization work closely with them, or were these conclusions reached independently of one another?
So we have coordinated, but the conclusions were reached separately, and then the timing was coordinated, but the conclusions are different. Also, the methodology and the findings are very different. We are looking at it in a more legal matter. They're looking at it in a more political and social matter. But the conclusion is the same: is that Israel is what is happening in Gaza, what Israel has been doing for the past 22 months, is a genocide. This is similar, but the timing was coordinated for two reasons. One, um, because it will gain more attention, and this is what we hoped for. And the attention is because to tell the world that it's also coming from within the Israeli society, and for us to you know to be, maybe we will be able to provoke to finally for someone, especially for third countries that are also signed on the genocide convention, are and should by law intervene. Unfortunately, we cannot stop it by now, but maybe we can at least to stop what has been happening, if not to prevent it. So was our hope on why we went together as two organizations, but it is a separate two reports.
Your report also warns that now that Israel has added genocide to its toolbox, spillover into the West Bank of the same tactics is already being witnessed. Can you give examples?
Right. So in our report, we more specifically analyze Gaza. We analyze what is happening in Gaza. But for the past 22 months, we've witnessed what has been happening in the West Bank, and it is scary because there were very similar tactics that have been used. So, for example, if we look at hospitals, there were hospitals that were bombed. There were, the same kind of tactics that we heard in Gaza. So take it for example in Jenin, the Jenin hospital. So it was besieged. No patients were allowed to go in without checking them, and no one were allowed to go in. Infrastructure around it, so roads were destroyed around it, and that of course prevents ambulances and humanitarian teams to access the hospital. These are tactics that we've seen also in Gaza. And it has been called by B'Tselem, by the way, and others as a gasification, right? These tactics are very similar in the healthcare system, but also there have been ethnically cleansing of of communities, thousands of individuals in the North and West Bank. There are 40,000 people who have been, displaced from their own homes, and where they have been transferred to makeshift tents and to go live with their families if they have. So basically, in the area of Jenin, there were 40,000 people. This is numbers that when I read them, when I hear them, this is amazing. Immediately, I have immediately a red flag that this is very similar tactics that have been happening in Gaza. And from my point of view, if the reason why the reason why Israel is continuing this, genocidal campaign, and there is a chance that it could slip to the West Bank. It's this green light that I've been talking about, the green light from the international community, from the international society, from countries for not stopping Israel for the past 22 months. And this is how it has been continued, not just in the West Bank, Lebanon, for example. We also saw destruction of hospitals there. So this is scary, not just as a Palestinian. This is scary as a world. This is scary as international community.
I find it amazing that actually your report, both your reports and B'Tselem's, got a lot of attention internationally. Even at the State Department, journalists were asking the spokesperson about them. So it reached the United States. I know the White House is aware of these reports, and yet you mentioned that more than 90% of the Israeli society is unaware of what's going on. I mean,
yes.
Is that part of the censorship, or they just decide to bury their heads in the sand and ignore what's going on?
Both things. So I can give you an example. There's when I open the mainstream Israeli channels, specifically now when all of the world is talking about starvation, you'd hope at least one article, at least one coverage will be nothing. They don't show anything. The only way they mention the starvation in Gaza and the children is by calling it, as I mentioned, a starvation campaign, calling it AI pictures fabricated by Hamas. This is not true. And this has been the case for the past 22 months. You don't see anything. If you see something about Gaza, you would only see drone pictures from above of destroyed houses. Removing the human experience, removing what Israel is doing to the people, you only see maybe destroyed houses. This is part of the dehumanization, right? You don't see these conditions of life that I've been talking about. You don't see people looking for food. You don't see people without shelters. You don't see people who have skin infectious diseases and they're not treated. Babies that don't have food. You don't see that. The only thing you see is only very, very far pictures of destroyed houses. And for the second thing you mentioned also, even there's a big part that don't want to know, basically justification that they deserve it. If they didn't want it to happen, they shouldn't do 7th of October. They brought it on themselves. And this is weird from the Israeli public, but it didn't come up out of nothing. These are, policymakers and Knesset members and the prime minister and the president who said that. And then the Israeli public will also repeat it. And then also the army on the ground, on the very lowest, on the lowest level, will do what their leaders have been saying, right? Carrying this genocidal campaign. So it follows from the prime minister all the way to the public, to the army. And this is why this is intentional. This is intentional. And this is a campaign that is, I dare even say that this is the news, the Israeli news is part of this campaign. They're part of the genocidal campaign for not showing, for not speaking about what is happening.
One of the questions that was posed to the spokesperson of the U.S. State Department was mentioning, as I've mentioned, many people have warned about the genocide, like members of the United Nations and other organizations, and Francesca Albanese, who is the rapporteur for the Palestinian territories, who has been basically sanctioned by the United States, and others now are being sanctioned. And one of the questions was, well, now 2 Israeli organizations are saying the same thing. Are you going to sanction them? And the spokesperson kind of like avoided answering that question. But is this something that you are concerned about?
Concerned about if it will happen or that it should happen?
Well, I mean, they're sanctioning everybody, but and usually the United States goes along with Israel, but you are an Israeli organization. B'Tselem is also an Israeli organization. And are you concerned that the United States might sanction you, restrict your travels, funding, etc.?
So there has, of course, yes. We know that the Trump administration have been basically sanctioning anyone who speaks, right? Even sanctioning ICC's own prosecutor, right, and the ICC itself. So this is not something that is far. It could happen, but we weren't the PHRI and any human rights organization, especially when working in a fascist state. These risks. These risks, and if the risks come against saying the truth and what is happening, we must say it. Not because we're courageous, but we weren't. The organization haven't been established to stay quiet and follow the what the mainstream is saying just to protect itself to keep going. No, um, just like any fascist country, we know the risks. We know that it could maybe risk the organization, but we must say what it is. We must, as you mentioned, Francesca Albanese have been warning and saying, hope, in hope that the genocide will stop, not because we want to use it politically, not because we want to say genocide politically, because, and especially coming up from an Israeli organization, the people who wrote this report, me amongst them, but I'm a Palestinian, but there are, three more Israeli authors that it hurts to say about your society, about your government, about Israel that is carrying a genocide. But still, it is important to say the truth, and this is why human rights organizations, were established. This is also following by international law. So even if risks could happen, we should say what we're seeing legally and morally.
Well, on the other hand, I mean, you're appealing also to the outside world, which we're witnessing a shift, let's say, a slight shift in now attitude by governments, and of course by the millions of people who have been demonstrating. Yet, despite international outcry, despite international legal rulings, Israel has not complied with its obligations, including two outstanding warrants from the ICC charging its prime minister and former defense minister of war crimes. They roam freely and travel across the globe. Hence, international enforcement remains weak. Some organizations say that the only way to force Israel to comply is through boycotts, including boycotting the Israeli healthcare system. Is this something that your organization supports? If not, what does it recommend as a way to make Israel comply with international law?
So, in my opinion, international international institutions, including medical associations, as well as governments, should do anything in their toolbox. There's a lot of things that they can do. They should do anything in their toolbox in order to stop this. For Israel to comply by international law, anything in their toolbox that should be done. Um, from ourselves, we have pressuring the Israeli Medical Association. We have also been sending letters, and we have been in close communication with international medical associations, and also to pressure the Israeli Medical Association, hoping for that to do something, because the medical, the healthcare system, the healthcare care in Israel is also complicit in this, is complicit for not speaking, for not talking, for not speaking anything for the past 22 months. And surprisingly, only after the British Medical Association have cut ties with the Israeli one, and only then, surprisingly, the Israeli Medical Association have issued a statement urging the army to send more aid, and quote, we didn't know the data, we didn't know that starvation is happening. This is the medical Israeli Association for you. That it's not just that, also universities. I think this week have sent a letter to the prime minister saying that they're worried 22 months after sending a letter We were seeing what is happening. We're really worried about, the conduct in Gaza, and the starvation in Gaza, asking for more aid. Five university heads have issued this letter. Everyone is complicit. Everyone is complicit.
Aseel Aburass, thank you for coming on Arab Talk.
Shukran. Thank you so much.
That's the voice and the face of Aseel Aburass. She's the director of the Occupied Territories Department at Physicians for Human Rights in Israel. That report, Jamal, Destruction of Conditions of Life, a health analysis of the Gaza genocide, is a profound indictment of the moral, ethical, and frankly, illegal activities that Israel and its military have conducted against the healthcare infrastructure, with so many hundreds of healthcare workers, including doctors and nurses, being murdered, thousands being detained and put under harsh conditions, including torture. There is not a more damning report than this. I wonder if the world will pay attention.
Well, I don't know how many angles can you describe this. Where can you who's going to talk about it? Who's going to provide more evidence, or how many people? It's there. Whether you people want to deny it, they're going to be genocide deniers. Last week, we had a world-leading expert talking about the starvation and a deliberate starvation. And this week, we have one of the representatives of the two organizations talking about, an Israeli organization talking about a genocide. And I think it's now, the evidence is all out there. It's just like for the few who want to keep defending Israel and denying that there is a genocide and making excuses for Israel. And we're going to talk about our next, main story shortly, which is basically this genocide it's going to multiply because, as you know, the Security Cabinet of Israel approved last Thursday, they went on overnight, a proposal by the Israeli Prime Minister Benjamin Netanyahu to take over a densely populated Gaza City, bucking warnings from their own military, Jess, that the operation risks the lives of the remaining hostages, in addition to potentially sparking a humanitarian disaster. And they can play gymnastics with the words, because I was looking at the decision. They did not use the word occupy. Instead, they refer to it as a taking over, so they can circumvent legal
whatever
reasons.
That means, right?
Well, it's actually, I had to look it over and study it, and it's really trying to circumvent legal reasons, because
Nobody buys it.
Occupation has a definition, which means that Israel will be responsible for the starving population. They will be responsible for their well-being, as they should be, in, for example, the West Bank, which they're not. They allow their settlers to kill Palestinians day in, day out. They allow the theft of land day in, day out, and so forth. But under international law, that's why they're trying not to use the word occupation. And now, just you're talking about the area they want to go into, roughly 1 million Palestinians, many of whom have already been displaced several times throughout the 22 months, are now all in Gaza City. That's for people who are not familiar. Gaza, there is the Gaza Strip, and then there is the Gaza City in northern Gaza. And which means many of them will be killed, slaughtered, and Israel will make excuses, and they'll say that it's a mistake, or they were killed by Hamas, and so forth. And many of them will be starved to death. So that's the decision that we are facing now.
Yeah, but the kind of painful reality and painful hypocrisy of the world, Jamal, is that finally, after 2 years, almost 2 years now, we're coming close on it. It's 22 months, going into 23 months of a genocide, of mass starvation, of war crimes, war criminals. Benjamin Netanyahu, who has a warrant out for his arrest, continues to put forth this policy that is causing this genocide and starvation of children, we see finally, we've been talking about this in the acute phase for almost 2 years, but we've also been talking about the damage that has been done over 76 years. But now you finally have, from the European leadership, the E3, it's called, France, Germany, and the UK, their leaders respectively, are finally, quote, and this is what the news headlines saying, putting maximum pressure on Benjamin Netanyahu to do something about the starvation. Well, you know what Netanyahu's response has been to each one of these leaders? We can't say it on the air, but Netanyahu's basically told them to go F themselves. He's going to continue to carry out his plan of genocide and ethnic cleansing in Gaza. So despite we see these kind of hypocritical announcements, we're going to acknowledge a Palestinian state, there must be more aid coming in. The reality on the ground, Jamal, is that Palestinian children are starving to death. More aid is not getting into the Gaza Strip, and the ongoing genocide continues under the watchful, supportive eye of the United States and President Trump. So we see this kind of bizarro world, if you will, where world leaders are trying to say these words, but they have no material impact on the ground in Gaza for Palestinian children, Jamal.
No, and every day, I mean, it's numbers, Jess. I mean, it's sadly, this is how the
Right.
world looks at every single day. Just Google Gaza. Just do that, and something will come up. 22 people were killed, 17 people were killed, etc. Every single day. Israel claims that they have 50 hostages in Gaza. Well, at least they can confirm that 20 of them are alive, maybe more or less. But every single day they kill half those numbers on a daily basis. Israel also controls 75% of the Gaza Strip. So when we're talking about controlling the rest of Gaza, that's the remaining 25%. So in other words, everything that happens in 75% of the Gaza Strip is under Israeli supervision, which is basically the starvation that we are talking about. And we're talking about all the deaths that are happening and the closed off hospitals. Everything is happening there. That's the only part which is like Gaza City, small enclave, and another smaller area there, which comprise 25%. And the reason Israel said they are not entering there, there's another camp. I forgot which camp is it close to that. That's they don't actually physically control, and where you have 1 million people living in that area, because Israel claims that this is where their hostages are, and they're trying to figure out, because they've tried that before, tried to rescue some hostages, and the hostages were executed, and in other instances, Israel killed its own hostages. And
Right,
just yesterday,
right.
I watched a flotilla of Israeli hostage parents and family members going towards Gaza, demanding to stop and demanding for a ceasefire and ending the war, because they're worried about their loved ones. But Netanyahu doesn't listen to anyone. He doesn't listen to his own military. He doesn't listen to his own security apparatus. He's just like, in the camp of the Ben-Gavirs and the Smotriches. So I just want to say, this is
No,
what
but
Netanyahu's office basically put their
sure.
demand, and they said, this is conditional. They're not going to go right away, but who knows? They say something, they do something else. Unless their demands are met, which will end the war, which they're saying that Hamas has to be disarmed, the return of all remaining hostages, the demilitarization of the Gaza Strip, Israeli security control over the Gaza Strip. We've heard that before. I mean, this is what Israeli security
Well, it already is. It already has been. It
over
already has
Area
been.
A in the West Bank, which is the largest swath of land of the West Bank. And finally, the existence of an alternative civilian government that is not Hamas or the Palestinian Authority. So they want to appoint, basically, if it's not Hamas, okay, but Hamas, by the way, said multiple times they don't want to be ruling the Gaza Strip. And it's not the Palestinian Authority, which is the internationally recognized body that was created by the way, by Israel and other players. If we go back to the Oslo Agreement and how the Palestinian, and now they don't want the Palestinian Authority. So who do they want? Who? They basically want their own puppet regime or their own
People.
appointees,
Right.
and they want to maintain security. So in other words, they want the land, they want control over the representation, and at the same time, they keep encouraging that people should leave the Gaza Strip. So we know what this is all about. It's all about ethnically cleansing Palestinians and taking over the Gaza Strip.
Yeah, that's all it is, Jamal. But I want to just clarify one thing that you and I both have been saying. We keep saying Netanyahu and the right wing government and Smotrich and Ben-Gvir, but the reality that the world has to face up to is that over 80% of Israelis support ethnic cleansing and genocide. Let's be clear about it. The majority of Israelis actually continue to support military action and the ongoing starvation of children in Gaza because the number of Israelis who are protesting right now against what the Netanyahu government is doing is so small in comparison. So I think we have to be very careful about our analysis because I think the typical analysis is that this is a Netanyahu driven thing or a right wing thing. Let's not forget that the majority of Israelis actually are in favor of what's happening right now in Gaza, which is, the world needs to wake up to this. This is what the United States foreign policy is right now, supporting a genocidal apartheid state right now. And, we need to continue to make that clear as time goes on.
Well, you're right about the polls. I mean, because you don't have now the large demonstrations that used to happen before October 7th.
You don't.
Against Benjamin Netanyahu. And that's a game that he's playing. The longer he basically can prolong the war, keeps this whole area in a turmoil, he can avoid going to jail. He can avoid going to face the courts. And I don't know about the United States supporting what's happening, because I see a shift, and we can save that discussion.
It's pretty small, man. It's pretty small.
I hear more voices, including voices on the Republican side, saying that enough is enough, and we don't want to keep sending our money to support Israel in its genocide. And they're using the word genocide. So we'll discuss this maybe during the next show. You've been listening to Arab Talk on KPOO San Francisco, 89.5 FM. Go to our website, arabtalkradio.com, to download the latest shows, and we'll talk to you next week.
We'll see you next week.